to 4 p.m. Additionally, calling 311, our operators at 311 will be able to connect you. Let me tell you how to get prepared for that call. Very simple. It should take only 5 minutes on the phone. You will be asked for demographic information, your race, gender, age, your medical history, COVID-19 history, contact information, and insurance information if you have it. And once you receive it, you will get a confirmation code that you should take with you along with your photo ID to your appointment. That confirmation code is your own. Then once you get the appointment, just remember to bring the confirmation code, a photo ID, and your insurance card. You should wear a loose-fitting shirt that allows the medical staff to get to your upper arm. After you receive your vaccination, be prepared to stay for 15 to 30 minutes for observation. You will receive a vaccination card or printout that tells you which COVID vaccine you received, the date you received it, where you received it, and when you should return for your second shot. The COVID vaccine is free. Those with insurance will not be charged a copay. Those without insurance will not be charged or turned away. So at this point, I think I'm going to ask Dr. Nesbitt to talk about what seniors should expect after the vaccine.
So we already know that the COVID-19 vaccine may cause side effects in some people, such as pain at the injection site, sore muscles, fatigue, or a mild fever. These reactions simply mean that the vaccine is working. For most people, such as myself, these side effects will last no longer than a day or two. While at your appointment, you will be given information as to how to register with a tool called VSafe. This tool allows you to communicate with the Centers for Disease Control and Prevention about your experience. I have found the VSafe tool to be quite helpful. It checks in with you every day during the first week of your first dose of the vaccine, and then weekly after that. It will prompt you to remind you that your second dose is due if you have not made that appointment for your second dose, which many of our providers are scheduling as you leave. Once you get your first dose, it will remind you to schedule that appointment. Once you have received your second dose, you go back into the VSafe system, and it starts checking on you every day again. And then we'll switch to weekly thereafter. And the VSafe system will check in for you throughout a 12-month period of time. You want to introduce? So now we have a few seniors in our community who have already been vaccinated. We have quite a few people in our community who wanted to share with you their vaccination experience and encourage you to get vaccinated. So this morning we're going to share with you a message from our very own DC Council Chairman Phil Mendelson and at-large Council Member Anita Bonds on why they want our seniors to join them in getting vaccinated.
I'm Phil Mendelson. I'm Chairman of the Council of the District of Columbia. And I got vaccinated today. I just got vaccinated because it's the right thing to do, because it will help to protect my health, and because all of us need to get vaccinated. And I hope that my example will make others feel more comfortable if they have any uneasiness about getting vaccinated. So to get your vaccine, you can go to the website vaccinate.dc.gov, or you can call 855-363-0333. That's it?
Yep, at 1 o'clock. That's it.
Okay.
I'm at-large council member Anita Bonds, and I just received the vaccine. And of course, I am encouraging you to be sure to get the vaccine as well. We want to keep ourselves as healthy as possible, and this is one main way to keep us from the coronavirus. Go to vaccinate.dc.gov, or you can call 855-363-0333.
So I want to thank Phil and Anita for making those videos and helping to disseminate them broadly. We, as you heard them say, that vaccination is the key to helping us unite with family and friends and getting our lives back. And I know that there are many seniors, and what we should all know is that we have seniors who are going to jobs, essential jobs. We have seniors who are helping to take care of other loved ones. We have seniors who want to see their grandkids. We have seniors who are living in congregate care facilities. So our senior social influencers fall into all of those categories. So we also want everybody to think about the seniors in their lives, talk to them about the vaccine, help them make an appointment if you need to by using the website or calling, and also helping to arrange for them to have the vaccine. With that now, I'm going to ask Dr. Nesbitt to share a little bit more about the tiers for the vaccine and what's next.
Thank you, Madam Mayor. So the U.S. Centers for Disease Control and Prevention has a three-phased approach to vaccination that assumes that during phase one, supply is constrained, and as such, the CDC recommends that vaccines should be administered in closed settings best suited for reaching initial critical populations. This is why you will only see a limited number of options across the city overall to receive your vaccine. Phase two assumes that there is likely sufficient supply to meet demand, thereby permitting an expansion beyond initial populations and the use of a broader provider network. During phase three, we shift to open access to vaccination because supply will at that time be sufficient, and vaccine will likely be available then through private provider sites. Furthermore, it is very important to note that with the two COVID-19 vaccines that have currently been approved for use in the U.S., the Pfizer-BioNTech and Moderna vaccines, they have highly complex storage, packaging, and use requirements that limit their ability to be used in small clinical environments such as private practices, as well as for their ability to be used in pop-up clinics in certain community or residential settings. Both the Pfizer and Moderna vaccines are not optimally used in any clinical environment where less than 100 people could be vaccinated in a given day. Because of that, the district is showing you our phased approach that also includes tiers within each phase. These phases will allow for us to have a very progressive approach to rolling out each phase. These priority groups will give us the ability to show you our detailed system that will allow individuals with chronic medical conditions and essential employees in various settings to better understand where they fall in order of priority in the district's phase system. It also gives us the opportunity to show you or clarify for you the construct of how prioritizing or using criteria that shows how either reducing the risk of severe illness and death or allowing for the preservation of societal functions helps us to establish individuals' place in a particular phase or tier within a phase. While the district is still unable to definitively state when each group will be able to access vaccines due to the fact that we do not control how much vaccine we receive from the federal government or how quickly individuals take up the vaccine in each group. The established tiers will allow for us to provide more clarity to the population. While we will not wait until 100% of a group is vaccinated within each phase or within each tier before we move on to the next tier, we will use information that we understand about our population's interest in taking the vaccine and indicators such as the slowing of uptake of a vaccine to indicate that it is time to move to a next tier. So here, I think everyone is very clear on phase 1A, where we have begun with the vaccinating of long-term care residents because they are at the highest risk of severe illness and death if they acquire the vaccine. We have demonstrated that in our data. And then the preservation of societal functions. Our healthcare system needs to be able to operate because they are the ones who care for us if we are diagnosed with COVID-19, as well as our first responders who have been on the front lines of this COVID-19 pandemic since the very beginning, and our frontline public health workers who help to operate our testing centers, who help to do our home visits for contact tracing. Were the first individuals to be vaccinated beginning December 14th. Phase 1B, we are implementing components of Phase 1B Tier 1 today, primarily on the prevention of morbidity and mortality side, with our DC residents aged 65 years and older beginning access to vaccinations today, as well as a rollout of some of our congregate settings of vaccination. The preservation of societal function or essential employees group will begin access to vaccination next. Tier 2 in Phase 1B will include additional essential employees such as our law enforcement, staff in K through 12 educational facilities. So this includes all staff who work in these environments, staff in child care facilities, and staff working in grocery stores in the District of Columbia. And then Tier 3 in Phase 1B includes additional staff working in our courts and legal systems, staff who work in health, human services, and social services agencies' outreach programs, and our frontline employees of our public mass transit agencies, individuals employed in manufacturing, individuals working in food, packaging, and distribution, and the employees of our U.S. Postal Service. Phase 1C, the first tier, adds our DC residents who have chronic medical conditions. Depending on the current rate, based on the current rate at which we are receiving vaccines, we do not believe we will have to break this group out into those individuals who have chronic health conditions that are linked to a severe, who have a known link to a adverse outcome from COVID-19 versus those that are not yet identified, because what we are still learning more about COVID-19. And then the preservation of societal functioning or essential employees group are essential employees in our district government agencies, essential employees of public utilities, essential employees in non-governmental health, human, and social services organizations, agencies. These are the ones who don't do direct outreach. They have less interaction necessarily with the public in their homes, in the streets, or out in the communities, where their workspaces maybe could be modified more readily. And then individuals working in commercial and residential property maintenance and environmental services. Tier 2, we add more essential employees. So individuals working in non-public transit or mass transportation services, so for-hire vehicles and rideshare, individuals who are working in logistics, delivering courier services, and individuals working in media and mass communications. Again, these are essential employees who are required to report in person or on duty in person throughout the public health emergency. And then Tier 3 of Phase 1C are all essential employees of institutions of higher education, individuals working in construction, essential employees working in information technology. The remainder of the 9,419 federal government agencies that have been identified by those agencies, and then individuals working in commercial and residential property management that have not been previously identified in the other Phase 1B and 1C criteria. Phase 2 expands to include the remainder of DC residents aged 16 years and older, not included in previous phases. We encourage residents to be vaccinated as soon as their first eligibility criteria is named. And once your phase has been announced, you remain eligible as we move through additional phases. So we began Phase 1B today. Healthcare workers remain eligible, but they will continue to have to now find appointments in combination with all of the enthusiastic seniors who are now accessing appointments as well. And the amount of vaccine that we are receiving on a weekly basis for first doses has not changed substantially. So it's to your advantage to get an appointment as soon as your phase is announced, so that you have fewer people in subsequent phases to, for a lack of a better word, compete for a vaccine. If you are higher priority because of risk to your own personal health, because of the risk of severe illness or death, or because you play a critical role as essential employees, we encourage you to be vaccinated as soon as possible. We know that there are some people who are saying, I'm going to wait and see. There have been millions of people now vaccinated. So the notion of needing to continue to wait and see, we hope that you now have confidence in the vaccine. So thank you, Madam Mayor.
Thank you, Dr. Nesbitt. And finally, I have one recovery update, and I want people to pay close attention to this. We know our entertainment businesses have been substantially affected by COVID, and we want them to know that the Bridge Fund applications to support your business are now available. So please go to coronavirus.dc.gov/Bridge Fund. So if you support entertainment and hospitality in the district and have an audio-visual business, event equipment rental, photographer, event planners, trade show event staffing services, event production companies, talent and booking agencies, tour companies, performing arts companies, event promoters, recreational sports leagues. These are some of the types of businesses related to entertainment and hospitality that can be supported by the Bridge Fund. Tomorrow, Deputy Mayor Falchicchio will be joined by Rebecca Linder to discuss, who is a member of the DC Event Coalition, to talk about the impact on those types of businesses and the Bridge Fund. Okay, with that, we can take a few questions.
Team with CNN. Given that Capitol Police Chief Sund said that he pled with the Pentagon for extra help from the National Guard as the Capitol was being stormed, do you think that's an accurate categorization of that? And what should have been done differently as all of this was going down? Where was the failure now that we know more after what happened on the 6th?
Well, I think that we will continue to learn more, and that there will be comprehensive looks at what happened or what should have happened. And we are very much looking forward to those investigations happening.
Given that Sund said that the Pentagon thought that the optics would be bad if the National Guard was in front of the Capitol,